Hello, and welcome to BrightCareHealth. Today's topic is one that almost everyone has faced at some point. Yes, I'm talking about bloating and flatulence, that uncomfortable fullness in your stomach, the gassy feeling, and sometimes embarrassing situations. But here's the good news. Today, we'll learn how to say goodbye to bloating and flatulence with these 10 simple tips. So, let's get started. Understanding the problem. Do you know this fact? Nearly 20% of people worldwide experience bloating on a weekly basis, according to a study published in Gastroenterology Journal. Bloating and gas are not just uncomfortable, they can also affect confidence, appetite, and even sleep quality. Before jumping into remedies, we need to understand the bloating causes. Why does bloating happen? It usually occurs when excess air or gas builds up in the digestive system. Common triggers include overeating, eating too quickly, food intolerances, poor digestion, and sometimes medical conditions like irritable bowel syndrome, IBS. Knowing the root causes helps us apply the right bloating remedies and achieve bloating relief. Tip 1. Eat slowly and chew thoroughly. Now let's discuss the first important aspect. Many people don't realize that eating too fast causes them to swallow air, which later leads to stomach bloating and gas relief problems. A clinical trial from the Journal of Neurogastroenterology and Motility found that patients who practiced mindful eating and slower chewing reduced bloating symptoms by nearly 40% within 2 weeks. So, number 1, slow down while eating and chew properly. Tip 2, identify and limit gas-producing foods. Now a question arises, which foods trigger bloating? Beans, lentils, cabbage, onions, broccoli, and carbonated drinks are the usual culprits. A controlled study published in the American Journal of Clinical Nutrition highlighted that reducing such high fermentable foods decreased flatulence frequency in IBS patients. So number 2, be mindful of gas-producing foods. This doesn't mean you must avoid them completely, just adjust portion sizes. Tip 3, try the Low FODMAP diet. Do you know this fact? Certain types of carbohydrates called FODMAPs, found in wheat, apples, garlic, and dairy, are poorly digested and cause gas. The Monash University in Australia conducted multiple trials where patients following a low FODMAP diet reported up to 70% improvement in bloating relief. So, number 3, consider a low FODMAP approach under a dietitian's guidance. Tip 4, stay hydrated. Now let's discuss another important factor. Dehydration slows digestion and contributes to constipation, which worsens bloating. A randomized trial in the European Journal of Clinical Nutrition showed that individuals who drank at least 2 liters of water per day experienced significant digestive health improvements and reduced bloating. So, number 4, keep yourself well hydrated. Tip 5, probiotics for gut balance. Now here's a fascinating aspect. Our intestines house billions of bacteria that regulate digestion. When this balance is disturbed, bloating and flatulence increase. A study from Alimentary Pharmacology and Therapeutics found that probiotics like Bifidobacterium infantis and Lactobacillus plantarum significantly reduced bloating in IBS patients after 8 weeks. So, number 5, add probiotics through yogurt, kefir, or supplements. Tip 6, gentle physical activity. Do you know this fact? A 20-minute walk after meals can dramatically improve gas movement and reduce bloating. In a controlled study at Johns Hopkins University, participants who walked daily reported 50% faster gas clearance compared to those who remained sedentary. So number 6, engage in gentle exercise like walking, yoga, or cycling. Tip 7, herbal remedies. Now let's explore natural remedies for bloating. Herbs like peppermint, ginger, and chamomile have been studied for centuries. A double-blind trial published in Phytomedicine Journal revealed that peppermint oil capsules reduced bloating and flatulence symptoms in 79% of patients with IBS. So number 7, use herbal teas or supplements like peppermint, ginger, or chamomile for gas relief. Tip 8, avoid artificial sweeteners. Now a question arises, are sugar-free foods always safe? Artificial sweeteners like sorbitol, mannitol, and xylitol are poorly absorbed and ferment in the gut. Research from the Journal of Gastrointestinal and Liver Diseases confirms that these sweeteners can increase bloating and gas. So number 8, limit sugar-free chewing gums and diet sodas. Tip 9, Improve fiber intake gradually. Now let's discuss fiber. Fiber is essential for digestion, but a sudden increase causes gas and stomach bloating. A trial in the World Journal of Gastroenterology demonstrated that patients who gradually increased fiber over 4 weeks had better bloating relief compared to those who increased fiber suddenly. So, number 9, introduce fiber slowly into your diet. Tip 10, stress management. Do you know this fact? Stress doesn't just affect your mind, it directly impacts your gut. Studies from the American College of Gastroenterology show that stress increases bloating and worsens digestive discomfort. Mindfulness, deep breathing, and meditation practices helped patients reduce gas and bloating symptoms by 35% in just 6 weeks. So number 10, practice relaxation techniques for better digestive health. Bonus insight, when to see a doctor. Now, a very important issue. If bloating comes with severe pain, sudden weight loss, vomiting, or blood in stool, it might indicate a more serious condition. The Mayo Clinic advises seeking immediate medical evaluation if such symptoms appear. Remember, most bloating is harmless, but sometimes it can signal underlying disease. Let me share a quick example from published evidence. In a controlled hospital study conducted at King's College London, patients with chronic bloating were divided into 2 groups. One group followed standard diet advice, while the other followed a structured, low FODMAP diet. After 6 weeks, the low FODMAP group reported greater reduction in bloating and gas, along with improved quality of life. This shows that evidence-based strategies can truly transform digestive health. So, how do we say goodbye to bloating and flatulence with 10 simple tips? Eat slowly and chew thoroughly. Limit gas-producing foods. Try a low FODMAP diet. Stay hydrated. Add probiotics. Engage in gentle activity. Use herbal remedies. Avoid artificial sweeteners. Increase fiber gradually. Manage stress effectively. Following these strategies gives you practical, science-backed bloating remedies and gas relief solutions. You now know how to reduce bloating naturally and take better care of your digestive health. I hope today's video helps you and your loved ones find comfort and better health. If you want more doctor-guided tips like these, don't forget to like this video, subscribe to BrightCareHealth, and share it with your friends and family. Together, let's spread good health and awareness. Thank you for watching. See you in the next video.